National Nurses Day. A few hours from now, President Trump will be honoring nurses across the country for their dedicated work on the front lines of this pandemic, Steve.
One of the nurses, Ainsley, headed to the White House later today at 12:15, served her community for 40 years before volunteering to come back out of retirement to fight COVID-19 in some of the hardest hit long-term care sites.
Joining us now is Marty Blankenship, who was retired in December and came back to help out over the last couple of months. Marty, what spurred you to put your retirement on hold and go back again?
Well, I knew that with the spread of the COVID, that it was just a matter of time before it got into the long-term care facilities, and those are our most vulnerable patients who need the care and the compassion that nursing provides. And that's really what I just wanted to go back and be able to provide care not only to the residents but to my fellow staff members.
Marty, a lot of people who aren't in the healthcare system, they're watching their relatives in the hospitals, and many of them are passing away, and they're not able to say goodbye. What is it like inside these hospitals, in these long-term care facilities?
You know, when I spend time talking with families on the phone, and I do hear the fear in their voice, and, you know, as a nurse, part of our job is to assure families that that will be at the bedside of their loved one, that they won't be alone. I see the compassion in my coworkers' eyes. I see the fear, you know, because they love their residents so much. We try very hard to keep families involved with what's going on. We use iPads and video chat with them, so it's very important to let the families know how much we care about their loved ones.
That's really a great point, Marty, because I was talking to my friend Madeline, who is a maternity ward nurse at one of the big New York City hospitals, actually the biggest, and she told me that every one of her mothers giving birth over the last couple of weeks has been tested positive for COVID, which is daunting because you know that the person right in front of you that you're in charge of has COVID. It is terrifying. So I get that compassion, but at the same time, you've got to be a little freaked out by it. How much, Marty, does it mean to you to be going to the White House today?
To be able to represent the company I work for, ProMedica, and to represent the profession of nursing that I love, it's an honor and such a thrill. I can't even put into words how excited I am.
Marty,